Good evening, everybody. It's very nice to see many people are joining the live session. It appears very good people are interested in the topic. Good evening, everybody. I am Dr. Jagadeesh Kanukuntla, Senior Consultant Physician, Continental Hospitals, specialist in diabetes, hypertension, asthma, fevers, high cholesterol and adult vaccinations. Today, my talk will be on are Indian men are at risk, and truths to uncover about alcoholism, diabetes, hypertension, high cholesterols and more. Indian men are at risk of various diseases. Among them are communicable and non-communicable diseases. So the non-communicable diseases are this alcoholism, diabetes, hypertension, high cholesterol, asthma and etc. Coming to alcoholism, Indian men are more prone to alcoholism either because of socio-economic conditions, because of their lifestyle, because of the place where they live and the type of work they do. Alcoholism is a silent killer and silent risk factor for developing liver diseases, heart diseases, heart attacks, brain strokes, development of diabetes and their complications. My message to everyone in the country and every father of the country or everyone who is having alcoholism is to stop taking alcohol and be a role model to your family members, to your son, to your daughter, so that they don't start taking alcohol and they don't continue this alcohol. Something which starts as a friendly drink during college days, which continues as a addicted drink during their adulthood and takes them into complications during the prime time of their life. This alcoholism is damaging and causing liver damage in most of the men, leading to liver cirrhosis and complications, and diabetes and its complications, and causing various deaths due to heart attacks. So every father in this country should take an oath to stop alcoholism and spread that to their children. We at Continental are here to give utmost support to all the people who are willing to stop alcoholism. We as a team of physicians, psychiatrists and caregivers are here to guide you how to come out of this alcoholism menace, alcohol dependency, and get rid of acute complications and chronic complications of alcoholism from you. So there is no moderation, there is no minimalization. Stoppage of complete alcohol is the only way to get rid of these complications developed due to alcoholism. Another chronic non-communicable disease affecting the men is diabetes. So more and more people are getting this diagnosis of diabetes, not only in adulthood and old age. Many young people are getting diagnosed with diabetes, both in rural population and urban population. So diabetes is a disease which is caused due to high blood sugars in their body, which is happening as a main lifestyle modification. The main cause is because of the sedentary lifestyle, because of the high calorie intake, because of lots of stress that they are taking during their lives, during their workplace or during the family life and everywhere. So all this genetic predisposition is also one of the major reasons. All this leads to development of diabetes in their body, which is associated with high blood sugars. The early warning signs of diabetes is excess thirst, increased urination, excess weight loss, and few people there will be weight gain also with uncontrolled non-healing infections. So when anybody sees these types of warning signs, it is very much important to know that you may be having diabetes, and it's good to approach us so that we can do the appropriate investigations to guide you whether you are having diabetes or any other condition. Conclusion and give you prevention from diabetes, because diabetes is associated with various complications. The leading cause of death in men is because of heart attacks, and most common cause or risk factor for heart attacks is diabetes, and diabetes is associated with micro and macrovascular complications like heart attacks, brain strokes, kidney damage, eye problems. Silent vision loss called as diabetic retinopathy is main leading cause of vision loss in people suffering with diabetes, with foot amputations, non-healing ulcers, blood vessel problems, blood clots leading to amputations and of feet and various organs of our body. And diabetes is the leading cause of all major complications. So we need to know ourselves regarding this diabetes and prevent ourselves from developing diabetes. So if it is type 2 diabetes is a lifestyle disease associated with genetic predisposition also. So the lifestyle is in our hands. We have to control our lifestyle. We need to avoid taking excess amount of carbohydrates, excess alcoholism. We need to be active. We should not be sedentary in our life. We need to do regularly minimum 1 hour of exercise per day or 150 minutes of moderate to severe exercise per day. Avoid excess high calorie diet, high sweet containing foods, sweets, salts, oil foods and etc., and try to maintain your body mass index in the optimum level. Try not to be obese, not to increase your visceral fat, and always keep your sugars at check. So that's why if we can do regular health checks, we can identify diabetes before it is been identified, and we can identify it pre-diabetic level only and prevent you from developing diabetes. We at Continental provide various types of health checks which we can screen the identification of early onset of diabetes and other complications of diabetes, and we can guide you from not developing diabetes and not developing any diabetic related complications. Next major double silent killer which is affecting our country is hypertension and high cholesterol. Hypertension and high cholesterol is again a lifestyle disease which mainly develops because of sedentary lifestyle, high intake of fried and fatty food, high intake of salt, high salt containing diet in the packed food, packaged foods, in lots of pickles may predispose to development of hypertension in young and also adult and also old people. Development of hypertension in young is the major risk factor. So one of the major cause for developing hypertension is kidney problem also. Apart from kidney problem, lifestyle, sedentary life is related to hypertension and high cholesterol. This hypertension, high cholesterol leads to brain strokes, heart attacks, blood vessel ruptures, blood clots in various organs and leading to various complications. So this hypertension causes silent, it's called as a silent killer, because it can cause sudden death in people without any warning signs. So we need to take care of this hypertension. The early warning signs of hypertension is recurrent headache, giddiness, blurred vision, not able to concentrate on your work. So when you are feeling this type of things, it's better to approach us, and we at Continental have various screening approaches to screen the identification of new onset of hypertension and abnormal cholesterol in your body, guide you how frequent you need to go for regular checkups and when to start your medication, so that how your non-pharmacological lifestyle modification, doing regular exercise, taking proper diet will help in controlling your hypertension, diabetes, high cholesterol. And if that itself is not helping you, we through our pharmacological medications appropriately without causing any harm, seeing your genetic predisposition, seeing your risk factors, allergic composition, we prescribe the necessary medication to control your diabetes, hypertension and other lifestyle disease prevention methods. So coming to the bottom line, the first and foremost thing which we can take care is our own health. Men should focus on their own health. Men has to take care of their health and also the family health. So they has to prioritize their health. That is also more important. In our country, because of the socio-economic conditions, what my personal opinion is, men feel that they are beyond everything. They don't get any diseases. They should only take care of their family and friends. So they do the same, not taking their health into priority. They always concentrate on others, and in that case, they risk their own life. So I, through this platform, want to convey that take your health also into priority. Keep doing regular health checkups. Try to identify the silent killers that may be present in you, and we at Continental are always with you to identify those, to educate you how to prevent them, and if at all any is identified, we are here to in your journey to cure it in an appropriate way. So the lifestyle modification is very much important. Doing regular exercise, doing 1 hour of daily exercise or 150 minutes of mild to moderate severe exercise in a week, avoiding excess alcohol, sweets, salt, fried food, packed food, etc. should be avoided at regular intervals of time. Avoid taking deep fried food, and frequent outside eating should be avoided. Try to take healthy foods, more vegetables, more nuts, less salted diet, and more fruits to prevent your hypertension. So following your dietary advices, dietitian advices, taking diet advice as per your regular diet pattern. So we would like to take your lifestyle into a better way and to prevent all this onset of diabetes, hypertension, high cholesterols, and we need to prevent you from developing all the complications related to that and lead a happy and prosperous life with your family and members. I am open for all the questions. So the early, what are the early warning signs for diabetes is one of the viewer has asked me. So early warning signs of onset of diabetes is excess thirst, excess urination, and abnormal weight loss, and in few abnormal weight gain also. So this happens because of presence of high levels of glucose in your body. So this glucose will act as a diuretic, so it takes water along with you, and this water will come out through the urine. So when that leads to excess urination. So when you are urinating more, you will feel more thirst. So when you are having more thirst and you are urinating more, the glucose that is present inside the blood vessels is not available inside the cell because there is deficiency of insulin or there is insulin resistance. So this leads to non-generation of energy. Energy will be less. So this lack of energy will lead metabolism to take alternative metabolism, and it breaks down the fats and also proteins to generate energy. In that process, we will lose our stored fat, we will lose our built muscle, and there will be loss of weight that is seen in most of the people. So there is excess urination, you are losing more water from your body. Because of that, you have to drink more water, you will be more thirst, and there is alternative metabolism taken up by the body because the glucose is not taken inside the factory of producing energy because of deficiency of insulin or insulin resistance. So there is more glucose in the blood vessels, but it is not present inside the cell. So as it is not present inside the cell, the required energy is not present, and because of lack of that energy, you feel weak, fatigue. And as blood vessels are having more amount of glucose, that breaks down into various chemicals. So these chemicals are harmful to various organs of our body, and they damage our blood vessels, which leading to complications. And when blood vessels are damaged, the healing capacity of our body will decrease. As healing capacity of the body decreases, we are prone to more skin infections at various places, and these skin infections will not heal faster, so there will be prolonged healing. So when someone have all these features, you should understand that you are prone, you are in the risk of developing diabetes. And with simple blood test, fasting blood sugar, and 2 hours after any breakfast or any lunch, checking blood sugar, and 3 months average blood sugar, when we check, we seeing these 3 values, we will see and will identify whether your values are abnormal. When the values are abnormal, we will assess whether, based upon the value, whether we can treat it with lifestyle modification only, or we should add any medicines also. So we give an option to have a lifestyle modification to the best efforts, so that if that itself is controlling his sugars well, that itself is a treatment and he can follow that. If that is not happening, if that is not controlling the sugars, then we have to go for the pharmacological therapy also. So there is a condition, two types of diabetes many people have in their question: type 1 diabetes and type 2 diabetes. So type 1 diabetes develops irrespective of the lifestyle modification. It is purely genetic condition. It is because of complete absence of production of insulin in the body. So here the only treatment is insulin. We have to give insulin. Along with that, lifestyle also, good exercise, normal diet will keep the sugars under control. The type 2 diabetes, which we are talking since long time, is the lifestyle related disease. So that can be modified with lifestyle modification. If it is not modified with that, we have to go for pharmacological therapy. In that, we can give the medicines, we can give the insulin also. And one thing also I want to tell through this platform is, giving insulin is not a last resort in the treatment. It should not be given when somebody is having severe complications only. It is a last resort. Apart from nothing is there. When someone is starting insulin, my God, my life is over. It's not like that. We can start insulin as a first drug or a second line drug also. So insulin is always good and it controls the sugars very well. So what does stress impact men's overall health, and what are effective ways to manage it, is what another person is asking. So stress is a very high risk factor for various development of diabetes, hypertension and high cholesterol. So stress is a condition where there is high amount of steroids present in the body. So they release various hormones in our body during our stress condition, and those leads to increase in sugars in our body, more development of insulin resistance in our body, and related to development of diabetes, hypertension and high cholesterol, and related to all the complications of them. So stress management is very much important, doing regular yoga, exercise, balancing your work and family life, and giving your own space to yourself, trying to spend time with your family, your friends, and keeping yourself lively is very much important. So stress is the one which has to be managed in a very good way to prevent development of complications during young age and also during your later stage of life. So what role does genetics play in the risk of diseases like diabetes and heart conditions in Indian men, is another question asked through this platform. So genetics plays a big role. So for any disease to develop, the triad of things will be there: the host factors, the genetic factors and environmental factors. So for any disease, so your genetics predisposition plays important role, and unfortunately men of India are also predisposed to early onset of diabetes, heart diseases and various conditions. So keeping this genetics is a non-modifiable risk factor, because we can't change our genetics, it has come because of our birth. So we need to modify the modifiable risk factors like alcoholism, smoking, high calorie intake, sedentary lifestyle. This has to be changed, and these lifestyle modifications, modifiable risk factors has to be modified, and we should also take care of our environment. And keeping these three things under control, we can prevent development of various diseases. So lifestyle modification, doing regular exercise and proper diet. Mind your diet is very much important to prevent various non-communicable diseases including diabetes, hypertension and high cholesterol. And so what are the best lifestyle changes men can adopt to reduce the risk of chronic diseases? So chronic diseases that can present for more than 1 month are chronic diseases. So any disease that is present for shorter period, less than 1 month, is called as acute. Any fevers, infections, cold, cough, respiratory tract infections, any skin infections, these all are acute conditions. Chronic conditions which are present for long duration, like diabetes. Once we make a diagnosis of diabetes, it is for your lifetime you will be having diabetes as a condition. Either it is controlled with lifestyle modification or lifestyle modification and pharmacological therapy. It is controlled, but it is never reversed. We can only reverse the number, but not the condition. That is the message that I want to transfer through this platform. So we can always reverse the number. Someone who is having fasting blood sugar of 200 can always bring it back to 90, and fast postprandial blood sugar around 340, 350 can bring it back to 140, 110, 120. But that doesn't mean that you are cured. It has, the diabetes has been reversed completely. So if your lifestyle is modified, you deviate from your healthy lifestyle, again the values can go up, again the abnormal values can come, and if you're not concentrating on that, you may develop the complications. So once the situation has come, so you have to keep it like that, keep it in your mind and take necessary steps, keep your lifestyle modifying and take necessary medications if it is not controlling your values. It is all the number game. Keep the number in the optimum value. You will not have any complications, and you will have a long, happy life. So the best lifestyle changes is doing regular exercise, as I told you, minimum 150 minutes of moderate to severe exercise per week to the 1 to 2 hours per day. So to your amount of exertion, to your muscle capacity, to your exertion capacity, you can do regular exercise, isometric exercises or isotonic exercises under a proper guidance, so that you don't develop any strain, fractures or muscle tears. Eating less amount of salt per day, less than 2 grams of salt is advised to prevent any development of hypertension. As less as salt is good, but not zero, because salt is needed for our body. Sodium is needed for our body. If sodium is less, many people come to us with low sodium, so with the risk of having hypertension, risk of increasing hypertension, with a hope, if I stop salt completely, make it zero, I will stop medications, with the hope that many people stop taking salt. So, and by stopping the salt intake, they come to our hospitals with very low sodium. The normal sodium is between 135 to 145. If it is going less than 120, and that's the time where the cognition impairment comes, altered sensorium, loss of consciousness, fits will be developed, and many elders are coming to us with such situation of very low sodium. So optimum sodium is always needed for currents to pass in our body. So we are telling less than 2 grams of salt intake per day is always good. So you can take nuts, dry fruits can be taken. Anything that is less calorie is always good. You can calculate the total intake of food per day for you. So there is a 2000 kilocalorie diet, 1800 kilocalorie diet, 1600 kilocalorie diet, 200 kilocalorie diet, and 1000 kilocalorie diet. So the optimum sedentary person takes up to 2000 kilocalorie of diet. A optimum active person, enough of 1500 to 1800 kilocalorie diet is enough. If you are planning for weight loss, you can try 1200 kilocalories or 1000 kilocalories under guidance. That is very important. Try to have a guidance, try to calculate your calorie, try to calculate the carbohydrates that you are taking in, and then take necessary lifestyle modification, so that your lifestyle modification can prevent, cure your disease and make you free from disease, so that you don't develop complications. So, and drinking more water, 2 to 3 liters minimum, 3 to 4 liters of per day if you're not having any kidney injury. If there is any kidney injury, with a nephrologist consultation, you have to optimize the water intake. Avoid packed food to the maximum. Avoid excess pickle intake, because pickle has high salt intake for preservative, so that again increases the hypertension. And avoid deep fried food, so that you don't develop high amount of cholesterol, adulterated salts, trans fat acids in your body. So doing these lifestyle modifications with proper exercise, with meditation, stress relieving things. So giving 1 hour per day to your personal life, to your healthy life, to your exercise life, so you can prevent development of these non-communicable diseases. How can family members encourage men to take their health seriously and seek medical help when needed? So it is very much important, 1 to 1, hum saath saath, manam andaram mana kosam. సో మనము మన కోసం అన్నది చాలా అవసరం. మన ఫ్యామిలీ మెంబర్స్తో పాటు మనం ముందుకు వెళ్ళాలి, మన హెల్త్ చెక్ చేయించుకోవాలి, మన ఫ్యామిలీ మెంబర్స్కి హెల్త్ చెక్ చేయించుకుంటూ మనం ముందుకు తీసుకెళ్తే ఈ కాంప్లికేషన్స్ అనేవి రాకుండా ఉంటాయి. సో వీ హ్యావ్ టు టేక్ అవర్ ఫ్యామిలీ మెంబర్స్ టుగెదర్. సో హౌ డస్ ఆల్కహాల్ కన్సంప్షన్ ఎఫెక్ట్ ది లాంగ్ టర్మ్ హెల్త్ ఆఫ్ ఇండియన్ మెన్? సో ఆల్కహాల్, మత్తు పదార్థం, ఆల్కహాల్ అనేది చాలా ప్రమాదకరం. ఆల్కహాల్ తీసుకోవడం వల్ల మనకు ఆరోగ్యానికి చాలా హానికరం. అక్యూట్ ఇమీడియట్ కాంప్లికేషన్స్ అనేవి వస్తుంటే ఆల్కహాల్ ఎక్కువ తీసుకోవడం వల్ల, ఆల్కహాల్ తీసుకోవడం వల్ల అప్పటికప్పుడు మన బ్రెయిన్ ఫంక్షన్ ప్రాపర్గా జరగకపోవడం, ప్రాపర్గా డ్రైవింగ్ చేయలేకపోవడం, దానివల్ల ఎన్నో యాక్సిడెంట్స్ జరిగి ఎంతోమంది ప్రాణాలు కోల్పోతున్నారు. చాలామంది డ్రైవర్స్ కాజ్ ఆఫ్ డెత్ అన్నది ఆల్కహాలిజం లాగానే తెలుస్తుంది. ఈ ఆల్కహాల్ తీసుకోవడం వల్ల అక్యూట్ గ్యాస్ట్రైటిస్, స్టమక్ కాంప్లికేషన్స్, స్టమక్ అల్సర్స్, అక్యూట్ కాంప్లికేషన్స్ లాగా రికరెంట్ వామిటింగ్స్, లూజ్ మోషన్స్, ఫుడ్ పాయిజనింగ్స్, ఇవన్నీ చాలామంది తన వాల్యమైన సమయాన్ని, ప్రాణాన్ని కోల్పోతున్నారు. సో అవన్నీ అక్యూట్ కాంప్లికేషన్స్ ఆఫ్ ఆల్కహాలిజం లాగా ఉన్నాయి. క్రోనిక్ కాంప్లికేషన్స్ ఆఫ్ ఆల్కహాలిజం, లివర్ ఈజ్ ఎఫెక్టెడ్. లివర్ అన్నది ఎఫెక్ట్ అవుతుంది, లివర్ సిరోసిస్కి వెళ్తుంది. లివర్ సిరోసిస్ ఈజ్ ఎ డెడ్లీ ఇర్రివర్సబుల్ కాంప్లికేషన్. దానికి ఓన్లీ లివర్ ట్రాన్స్ప్లాంటేషన్ మాత్రమే దానికి ట్రీట్మెంట్. మేము ఇక్కడ కాంటినెంటల్ విత్ liver transplant team are very much equipped to treat that, but we don't want you to go to that stage. లివర్ సిరోసిస్కి వెళ్ళకుండా చూసుకోవాలి. లివర్ సిరోసిస్కి వెళ్ళకుండా చూడాలంటే మనం ఆల్కహాల్ ఇంటేక్ అన్నది తగ్గించాలి. ఆల్కహాల్ హ్యాస్ టు బి స్టాప్. ఐ am deadly against the intake of alcohol. At this point I also want to tell the various trolls, various reels that are going on in Instagram, social media by Trump says, I have raised my kid by saying no alcohol, no smoking, no drugs. So he is the president of America who has grown their children like that. So every person in India should also take it as an example and say no to alcohol, no to smoking, no to drugs. ఎవరు కూడా ఆల్కహాల్ తాగద్దు, స్మోకింగ్ చేయొద్దు, మత్తు పదార్థాలు తీసుకోవద్దు. మీరు మీ పిల్లల్ని సక్రమంగా పెంచండి, పెరగండి, కాంప్లికేషన్స్ రాకుండా చూసుకోండి. So there many people are trying to ask questions, still many people are joining also. It's my great pleasure to present myself in front of them. Diabetes వల్ల కలిగే కాంప్లికేషన్స్ ఏంటి, వాట్ ఆర్ కాంప్లికేషన్స్ డ్యూ టు డయాబెటీస్ అని అడుగుతున్నారు. సో డయాబెటీస్ వల్ల చిన్న రక్తనాళాల్లో కాంప్లికేషన్స్ రావచ్చు, పెద్ద రక్తనాళాల్లో కూడా కాంప్లికేషన్స్ రావచ్చు. చిన్న రక్తనాళాల కాంప్లికేషన్స్ని మైక్రోవాస్కులర్ కాంప్లికేషన్స్ అంటాము. పెద్ద రక్తనాళాల్లో వచ్చే కాంప్లికేషన్స్ని మైక్రోవాస్కులర్ కాంప్లికేషన్స్ అంటాము. ఈ మైక్రోవాస్కులర్ కాంప్లికేషన్స్ చాలా రకాలుగా ఉంటాయి. హార్ట్ అటాక్స్ వస్తూ ఉంటాయి. రక్తనాళాల్లో, కంటికి సప్లై చేసే రక్తనాళాల్లో కూడా బ్లాక్ జరిగి సడన్గా ఓవర్ నైట్ పెయిన్లెస్ విజన్ లాస్ అనేది జరుగుతుంది. రాత్రి మనం పండుకుంటాము, పొద్దుగల లేచి చూసేసరికి మనకు చూపు ఉండదు. సో అది డయాబెటీస్ కాంప్లికేషన్. డయాబెటిక్ రెటినోపతి అన్నది అది ఎవ్రీ ఇయర్ డయాబెటీస్ ఉన్న వాళ్ళు కంపల్సరీ చెక్ చేసుకోవాలి. అందులో ఏమన్నా డిఫరెంట్ స్టేజెస్ అనేటివి ఉంటాయి, ఐ స్పెషలిస్ట్ చెప్తారు. దాని ప్రకారంగా సంవత్సరానికి స్క్రీనింగ్ కానీ, 6 నెలలకు ఒకసారి స్క్రీనింగ్ కానీ, 3 నెలలకు ఒకసారి కానీ ఐస్ స్క్రీన్ చేసుకుంటూ ఉండాలి. అలా స్క్రీన్ చేసుకోవడం వల్ల ఆ సైలెంట్ డయాబెటిక్ రెటినోపతి ప్రోగ్రెస్ అయ్యి విజన్ లాస్ అవ్వకుండా మనం హెల్ప్ చేయగలం. మేము కాంటినెంటల్ హాస్పిటల్లో ఉన్న ఆప్థమాలజీ టీమ్ equipped to do screening for diabetic retinopathy and manage the complication and help you to prevent the development of diabetic retinopathy and vision loss because of diabetic retinopathy. అదేవిధంగా హార్ట్ సప్లై చేసే బ్లడ్ వెజల్స్ బ్లాక్ అయినప్పుడు సైలెంట్ హార్ట్ అటాక్స్ అనేవి వస్తుంటాయి, సడన్ కార్డియాక్ డెత్స్ అనేవి వస్తుంటాయి. సో మనకు బ్లడ్ వెజల్స్ లోపల క్లాట్ ఫామ్ అయిపోయి అది ఎప్పుడైనా సడన్గా బ్రేక్ అయినప్పుడు 50 to 60% బ్లాక్ ఉన్నది కాస్త 100% బ్లాక్ అయిపోయి కంప్లీట్ బ్లడ్ సర్క్యులేషన్ తగ్గిపోయి సడన్ హార్ట్ అటాక్ వచ్చే ఛాన్సెస్ ఉంటుంది. చాలామందికి హార్ట్ అటాక్ వచ్చినప్పుడు మనకు హాస్పిటల్కి వచ్చే అంత సమయం ఉంటుంది. కొంతమందిలోనే రాలేని పరిస్థితి అనేది జరగచ్చు. వాళ్ళని బతికించుకోవడం కూడా చాలా ఇంపార్టెంట్. వాళ్ళని బతికించుకోవడానికి రెగ్యులర్ హెల్త్ చెక్స్ చేయించుకోవాలి. Frequent health checks are very much important. When we do frequent health checks, we can identify that whether you are having the risk factor of developing the sudden heart attack. So you are to check your heart rate frequently, BP frequently, sugars frequently. Treadmill test has to be done very frequently. All these tests are included in the mass health checkups and geriatric health checkups of our hospitals, which can identify this presence of these diseases before it has developed. So అదే ప్రివెంటివ్ హెల్త్ చెక్స్ అంటే, స్క్రీనింగ్ హెల్త్ చెక్స్ అంటే మనకు డిజీజ్ రాకముందే లోపల ఉన్న కొంతవరకు ఉన్నప్పుడే దాన్ని ఐడెంటిఫై చేసి పూర్తిగా డిజీజ్ రాకుండా చేసే ప్రక్రియనే ప్రివెంటివ్ హెల్త్ చెక్స్ అంటాము. వాటిని మనము ఎవ్రీ క్రమ పద్ధతికి తప్పకుండా ఎవ్రీ ఇయర్ కానీ వన్స్ ఇన్ 2 years కానీ ఈ హెల్త్ చెక్స్ అనేవి చేయించుకొని మీలో ఉన్న ఈ ప్రాబ్లమ్స్ని ఐడెంటిఫై చేసుకొని వాటిని ట్రీట్ చేసుకోగలిగితే ఈ డెడ్లీ కాంప్లికేషన్స్ని మనం ప్రివెంట్ చేసుకోగలుగుతాం. సో ఆ హార్ట్ అటాక్స్ని ప్రివెంట్ చేస్తుంది. ఆ చిన్న చిన్న బ్లడ్ వెజిల్స్ కిడ్నీకి సప్లై చేసే బ్లడ్ వెజిల్స్కి వెళ్ళినప్పుడు కిడ్నీ ఫెయిల్యూర్ జరిగే అవకాశాలు ఉంటాయి. బ్రెయిన్కి బ్లడ్ సప్లై చేసి దాంట్లో బ్లాక్ అయినప్పుడు బ్రెయిన్ స్ట్రోక్ ఫామ్ అయ్యే ఛాన్సెస్ ఉంటుంది. కాళ్ళకి కానీ సప్లై చేసే బ్లడ్ వెజిల్స్ బ్లాక్ ఉండడం వల్ల అక్కడ బ్లడ్ సర్క్యులేషన్ తగ్గి ఇనిషియల్గా అల్సర్స్ ఫామ్ అయిపోయి పుండ్లులాగా అయిపోయి దానివల్ల డయాబెటిక్ ఫుట్ లాగా అయిపోయి యాంపిటేషన్ వెళ్ళే పరిస్థితి ఉంటుంది. ఈ విధంగా డయాబెటీస్ వల్ల చిన్న రక్తనాళాలు పెద్ద రక్తనాళాలు పొట్టకు సప్లై చేసే రక్తనాళాలు బ్లాక్ అవ్వడం వల్ల స్టమక్కి కానీ ఇంటెస్టైన్స్ కానీ బ్లడ్ సర్క్యులేషన్ తగ్గి ఇస్కిమా డెవలప్ చేసి సివియర్ పెయిన్ వచ్చి పెద్ద ఆపరేషన్స్ అయ్యే ప్రమాదం ఉంటుంది. ఈ విధంగా పెద్ద రక్తనాళాలు చిన్న రక్తనాళాల కాంప్లికేషన్స్ వల్ల ఎన్నో ఆర్గాన్స్ మన బాడీలో డయాబెటీస్ వల్ల హాని జరిగే ప్రమాదం ఉంటుంది. సో థ్యాంక్ యూ.